Happy New Year, everybody, and welcome back to the Community Preceptorship Program Orientation. For those of you who are joining us this year, thank you so much for your support. So through this presentation, we just want to give you a quick overview of the New Jersey Medical School curriculum, as well as the pre-clerkship clinical courses, and also the patient-centered medicine course. The content, the community-based preceptorship that you're being part of, your role as a preceptor, the attendance and evaluation for the students. So in terms of the curriculum, so for the past few years, New Jersey Medical School has tried to work on integrating courses together so that the material makes much more sense for the students. So for example, the students maybe previously will learn about histology separate from physiology in a separate class. Now we try to teach them together in a new class titled Integrative Structure and Function. We feel that by providing this interdisciplinary approach, we are allowing our students to have a more of a comprehension of the basic science material. We also have integrated our organ system curriculum along with our patient-centered medicine course. So for example, if the students are actually learning about the cardiac pathology in the second half of their first year, they also are practicing at the same time how to do a heart exam on real cardiac patients and at the very same time on each other when they're practicing on small groups. We also have been trying, like I said before, to integrate more a small group instruction that is actually either led by a faculty member or by the student themselves, and try to have less lecture time in large lecture halls. Also, New Jersey Medical School has taken a leadership role at the national level in teaching medical students about communicating with diverse cultures and in providing culturally competent care. We'll talk about this in a few minutes. So this is just an overview of the curriculum throughout the 4 years of the medical school. For the first year class, which is a class that is going to be going to your office, by the time they get to your office on January, the students had already taken the course called Foundations of Body Systems, and then on January they will start the organ system approach as listed here on the slide. Throughout the first year, from the beginning of their first year medical school, the students have been part of the patient-centered medicine course, which I will explain in a little bit. When the students come back from their first summer, they continue with the organ system approach, and then it's followed by their OSCE, and then their step 1, and then their third year begins when they start going on rotations on the floors. So in terms of the patient-centered medicine class, which is the class that actually integrates the preceptorship program. So for the first year class, between August and December, the students are taught how to do an interview. They are taught how to do a complete interview from HPI to past medical history, medications, allergies, social history, risk factors, and review systems. They have a combination of lectures as well as small group sessions. Once they learn how to perform an interview during the lecture, the students are broken down into small groups, and with the help of a facilitator, which is a faculty member, the students are able to practice on each other via vignettes that we provide them. During these first few months of medical school through the patient-centered medicine, once the students have learned how to elicit a complete history taking, we try to integrate how to approach different types of topics with their patients or patients' family members. We try to have standardized patients who are allowing the students to practice how to elicit how to discuss a DNR order, or how to screen for domestic violence, or how to screen for alcoholism. We also have provided the students with a diverse number of ethical issues, so they can actually review ethics, humanism, and professionalism. Also, we have the TOSCI session where the students are able to practice with standardized patients how to elicit a complete history taking, and they receive feedback from a faculty member as well as their peers right away. At the end of the first few months of the first half of the first years, the students are evaluated via the OSCE, which is the Objective Structure Clinical Examination session. Again, with the use of a standardized patient, now with a formal evaluation, the students are asked to perform history taking on a particular case in an amount of about 10 to 12 minutes. Also, through the patient-centered medicine class, the students were able to participate in one session in our interdisciplinary rounds at University Hospital, where they're able to witness how social workers, nurses, case managers, and physicians work together in preparing a patient for discharge. Our students were also part of the opportunity of talking to real patients who were diagnosed or are currently being treated for either breast cancer or ovarian cancer. Students are able to talk to them and ask any kind of questions they want, so they can actually learn the patient's point of view of the patient-doctor relationship. By the time the students get to your practice on January, again, like I said before, we start the organ system approach. During this time, again, the students are expected to know how to perform a history taking, and on January, they will start learning the physical examination skills. So we are integrated our physical skills with, basic sciences like anatomy, physiology, histology, etc. So they have lectures with the previous half of the year, and they also have the facilitator-led small groups. So they practice on each other. Once they learn physical exam, they're actually able to practice on each other during a time of 2 to 3 hours. And prior to their session, they are encouraged to watch a video that demonstrates the proper way of doing a physical exam, for the week prior to their assigned session. Also, for each of the organ systems, the students are required to complete an online case. And by the end of the first year, the students are required to complete the OSCE, where they are being evaluated not only on their history taking, but also on their physical exam skills. So in terms of an overview of the content, so by January, February, the students are learning the proper way of doing hand washing, how to take vital signs, and the musculoskeletal system. By March, the students will be learning cardiovascular and peripheral vascular system, and by April, the students will be learning the pulmonary system. So in terms of your role as a preceptor, so we're just giving you a quick overview of what's to be expected out of the students each session that they go to your office. So for the first couple of sessions, we just want the students to maybe shadow you as you see your patients so they can actually learn how you do your work. If you can just let them learn the culture of your practice for the first week. The second week, besides shadowing you, if maybe they can be allowed to shadow your office manager so they can actually learn about the health system and the business behind an office practice, billing and coding. Week of February 3rd, there will be no sessions. So session number 3 will be on the week of February 12th. By this, the students already know how to take vital signs. So if you want to allow your students not only to take a history, but also take the vital signs of your patients, they should be able to. Session number 4, again, the students can be allowed to take vital signs, and by then they should already know how to perform an upper and lower musculoskeletal examination. Week number 5, again, the week of February 26th, could be a second week for the students to practice how to take vital signs and how to perform a musculoskeletal examination. Week number 6, again, the students should be able to perform as before, and they should be able to now perform a cardiovascular and peripheral vascular examination. Week number 7 could be another second week for them to practice the two systems and taking vital signs. The week of March 18 and the 24th will be no sessions, so the students will be expected to come back the week of April the 2nd, whereby then they should be able to perform a pulmonary examination on the patients. And then the last week, which is the final session, session number 9, the week of April 9, again, it's another week for the students to practice all their examination skills if you choose to do so. So in terms of your role as a preceptor, so we ask you, based on your time, of course, to try to directly observe your students at least once a month so you can give them feedback. Allow the students to practice presenting orally to you after they have seen a patient, and allow the students also to practice documenting their own findings, when they see patients on their own. And if you can please provide ongoing feedback to the students so they know what they need to improve on or what they're actually doing well throughout the night sessions they are with you. This is the attendance or evaluation card. So in the attendance card, you'll see each week by date and by the topic that the students should be able to perform in your office. So we just require for the students to get your signature at the end of the session each day. And then by the end of the preceptorship, we have a grading system for unsatisfactory, I'm so sorry, unsatisfactory, satisfactory, and outstanding. And then a small area for you to provide the students with some feedback in terms of requirement, in terms of improvement, that they need to work on so that they can actually perform better when they go to their hospital preceptorship during their second year or when they go to the floors, during their third year. If you need any issues, any problems with any of the students in regard to any absences, professional issues, you can contact Ms. Keisha Ferguson at 973-972-4823. And in terms of CME credit that you will be obtaining for your participation in our program, so all New Jersey physicians require 100 CME credits per 2-year licensing period. 60 must be Category 1 and 40 can be Category 2. Precepting for all non-sessions will give you 27 hours of Category 2 credit. We will send you a letter after the preceptorship ends with the number of hours you have provided for your documentation. And school-specific CME activity will be emailed to the practices. This is a preceptorship website. You can find all this information in our website in the link here on the presentation. And just thank you so much for your time, for listening to our orientation. Thank you so much for your time with our students in your office. And we look forward to working with you again next year.